Good morning everyone. Myself Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about some other joints in the feet. So first we are having the transverse tarsal joint, which is the mid-tarsal or chopard joint. Is a compound joint which is formed by talonavicular and calcaneocuboid joint. And usually these navicular and cuboid are immobile in weight-bearing foot. So motion at transverse tarsal joint is motion of talus and of calcaneum on fixed navicular cuboid unit. So we are having the talonavicular joint and calcaneocuboid joint. So usually the motion around the axis is triplanar, which produce the supination pronation, which couple component movement. So we can see the longitudinal axis of transverse tarsal joint inclined 15 degree superiorly from transverse plane and inclined 9 degree from the sagittal plane. So here we are having the 15 degree and here we are having the 9 degree. Function, so it is a link between hind foot and forefoot. Add supination pronation range and compensate forefoot for hind foot position. Next we are having the transometatarsal joint, and these are the plain synovial joint formed by distal tarsal bones and base of first metatarsal. So second TMT joint is composed of articulation between base of second metatarsal formed by the medial cuneiform and side of medial lateral cuneiform, third metatarsal and lateral cuneiform bones, fourth and fifth metatarsal with distal surface of cuboid bone. So we are array is defined as a functional unit formed by the metatarsal and its associated cuneiform, and cuneiform are included as a part of movement unit because of the small and relatively insignificant amount of motion. Function, hollowing and flattening of the foot, plus augment the function of transverse tarsal joint. Next we are having the tarsometatarsal joint function. Supination and pronation twist is usually done. So when hind foot pronate in weight bearing, it supinate to some degree to counter rotate the forefoot. In pronation, both hind foot and transverse tarsal are locked in supination. So adjustment position must be left entirely to TMT joint. So these are the figures showing the first is showing the extreme pronation at subtalar joint and extreme supination at the subtalar joint. Metatarsophalangeal joint. So these joints are formed proximally by the convex head of metatarsal and distally by concave bases of proximal phalange. So we are having the 5 joints are condyloid with 2 degree of freedom: extension flexion, or we can say dorsiflexion, plantar flexion, or abduction flexion. Metatarsophalangeal joint function, usually MTB extension around single oblique axis through second to fifth metatarsal head. Also shifts the weight laterally, maximize the large load on first 2 digits. We are having the arches of foot also. So dampen the impact of weight bearing forces, dampen the superimposed rotational motion, adapt to changes in the supporting surface. We are also having the plantar aponeurosis. It is a passive structure which contributes to arch support, and posteriorly it begins on medial tubercle of calcaneus and continues anteriorly to attach by digitations to plantar plates and then via plates to proximal phalanx of each toe. Thank you.